Hello friends, welcome back to Indo Tales from Life. In this video, let me give you a quick clinical tip regarding radiography in not just endodontics but also in general practice, because very often I hear people saying that taking radiograph with the traditional analog IOPA films was much easier compared to the digital RVG sensors. Why is it so, and what is the solution is what we are going to see in this video. Well, basically, there are three types of radiographic options in your general practice and endodontic practice. The first one is the conventional analog film, with which we all started in our dental school. And till date, it is definitely not inferior option. It is still loved by many because it is flexible, easily covers 3 to 4 teeth. And you know the reason why it is easy to take a radiograph with this? It's not just the flexibility, it is because of the size. It is a size 2 film. So people who loved the analog film, when they wanted to move digital, one of the best options for them is the POSPER plates. POSPER plates feel exactly like the analog films, and they are also available in different sizes, but again the one recommended for adults is the size 2. And some of the popular brands in the market or VistaScan or the one from Kerr or even Woodpecker has it. So this is the digital version of the analog film, and you can see just like how we used to enjoy a lot of tooth coverage with the analog films, we get the same thing in this as well. The third option is the RVG sensors, which is most common in most dental practices. But people who started learning their radiography with the conventional film or POSPER plate struggle to take a radiograph with the the RVG sensors is because I don't know why, for what reason, in India especially, the most common size that is sold to practitioners is the size 1. Yes, size 1 is exactly not meant for adult radiography, and that is the reason why people struggle. So you can see people sometimes even go to the extent of taking 2 radiographs, one for the periapical region, one for the coronal region, because they struggle to cover entire tooth in just one view. And this is also a common scenario in a dental practice. When you open some patient's folder, you see so many radiographs. Half of them are because of cone cuts or not able to cover the target area. So why is it so? Doesn't companies have size 2 RVG sensor? It is very much there, but in India not a lot of companies promote it or come forward with the size 2. Including me, when I first bought my RVG sensor, it was size 1, and I also faced the same struggles. Yes, you can master it with a little bit of paralleling technique, but still, when you have a size 2, which was recommended in the dental school and with which you can easily cover up a lot of teeth easily, why do we struggle with the size 1 sensor? So that is the reason I moved to a size 2 sensor, and ever since I did that, life has been so easy, as you can see in some of these cases that I'm going to show you. But what will people do who already have a size 1 sensor? Then here is the small tip. Instead of taking radiograph with the horizontal in a horizontal angulation, you can just flip your RVG sensor vertically. When it comes to long teeth, you can cover an entire molar without the periapical region or the coronal part getting cut off. That is one tip for those who already have a size 1 sensor. But for people who are considering buying a new RVG sensor, I would definitely recommend this size 2. I've been using this for more than a year now. Life has become so easy. As you can see, you can get the same view that we used to get with POSPER plates or the analog films. Both in the anteriors, you can see 3 to 4 teeth are getting covered, and in the posteriors also you can see easily 3 teeth you can cover in one radiograph, which is how an intraoral periapical view is supposed to be. And another example in the mandibular region here. So apart from this, one more thing that is a common practice in India is a lot of companies sell their RVG sensors without the position holders. So this is also one reason we don't understand why, because when I talk to my friends abroad, they tell me that whenever they buy an RVG, no company gives it without an RVG sensor. Yes, I mean the positioner or the RVG holder. The company can definitely charge extra for that. That's a different topic, but they should always give the option here. A lot of companies, when you ask them about the RVG holders, they say they don't have it. So when you choose your RVG, again, you need to be smart enough to, buy an RVG with the holder. So there are different types of holders. This is my personal favorite, which is called the paddle holders, because with experience, you don't need the positioning cone or the circle in your holder. This is more comfortable to take radiographs with the rubber dam on. So being an endodontist, I personally prefer this. So that's again one of the reasons for showing two particular brands in this radiograph. You can see an example of a master cone taken with a size 2 sensor with the paddle holder, and see how comfortably we can cover the periapical region and the accuracy. And again, another personal favorite, why I would say, is about these two brands is the contrast and resolution, especially for endodontics. So among the few brands, this might be a little biased because I haven't tried every brand in the market, but among the few brands that I've tried, I personally felt the Kodak and the Nanopix has beautiful contrast, which allows you to see even these micro anatomies like lateral canals, the apex pretty clearly. So POSPER plates are again very useful. We even have one POSPER plate system visitors can also now practice, which our associate dentists use, because the film is pretty flexible, easy for them to take. But for people who want to document their cases and project it on big screens during presentation, the POSPER plates may not be great, because very soon you see these scratches on the film. Yes, it can be replaced, but still I personally prefer RVG sensor, because the images are instant, there is no processing, and it is crystal clear. So what are the RVG suggestions that I would tell you if you are a practitioner who treat a lot of adults and kids? Then buying two sensors, if you feel, is expensive, you can go for POSPER plate system also when you have a multiple chair practice. You can go for POSPER plates, and another advantage apart from the flexibility, the versatility in sizes, it is the RVG, I mean the X-ray positioners are very economical. You can just use these economical positioners that we used to use with the analog films. The same positioners can be used with POSPER plates. That's the advantage of it. But like I told you, my personal preference is an RVG sensor, and size 2 is my choice, and my personal experience is good with these two brands. But I know there might be some other good brands as well. You can mention in the comments. And you need to have paddle holders, or any brand like Dentsply or Satlag. These are some reputed brands, but you need to choose your size wisely. And people who are majority treating adult teeth, which is going to be the majority in your practice, you need to have a size 2 sensor according to me. And these are the different types of positioners that other companies also provide, which will help you for taking bite wings or posterior or anterior radiographs. Hope this video was useful, and see you all soon in another video.